Let us start with the first lecture. So we have Dr. Tatjana Milenkovic. I hope I am pronouncing it properly. She is a professor of internal medicine at the University of Saint Cyril and Methodius Medical Faculty in Skopje. She works at a clinical of endocrinology, diabetes, and metabolic disease. She has established the Department of Education of People with Diabetes and Department ever since. She obtained specialty in internal medicine 1991, PhD in medical science, and in endocrinology 2004. She was in education and training in UK. Professor has published and authorized more than 100 scientific articles and international journals, and has been principal investigator and co-investigator, projects of which 11 international, including GCP training. She is author of 2 monographs and 5 book chapters, and she is a member of Executive Committee of Diabetic Education Study Group (DSG). She is a president of Macedonia Diabetes Association since 2013. So I invite Dr. Tatjana to start her deliberation.
Dear chairs, thank you so much for your kind invitation. I'm really honored to be again with you, with my dear Indian friends. Thank you to organizing committee and also to Dr. Banshi Sabo for this invitation. I'm really happy to be today with you and to share, I think, so very important topic on diet and what is the major tips that clinical practitioners should know about diabetes diet. So the nutrition therapy is one of the main principles of the treatment of diabetes. And these are the recommendations for the purposes of this therapy that have been recently published. And the main goal of these recommendations is to promote and support the healthful eating pattern among patients, to emphasize a variety of nutrient dense food in appropriate portion size in order to improve overall health and specifically to improve metabolic control and HbA1c, the blood pressure and cholesterol level or lipid levels. So these goals are quite different for individuals, and these goals are based on individuals' age, duration of diabetes, the healthy history, and other present health conditions. And in addition, the healthy nutrition is very important for patients with diabetes to achieve and to maintain their body weight and to delay or prevent diabetes complications. So nutrition treatment must be individualized to address individual nutrition needs. They're based on personal and cultural preferences of different patients, their health knowledge and skills of individuals, and they should be able to assess the healthful food choices, their willingness and ability to make behavioral changes, as well to recognize some barriers they may have during these changes they must make in their life. So in order to maintain the pleasure of eating, the eating patterns has to provide a positive message about food choices, while limiting food choices should be suggested only when it is indicated by some scientific evidence. So in order to propose this recommendation, the published results on the effectiveness of several types of dietary approaches, such as Mediterranean diet, vegetarian or vegan diet, low-fat diet, very low-fat, low-carb, very low-carb, DASH, and paleo diet, have been analyzed. And what is common for all these approaches or recommendations is that they must emphasize what is the importance of non-starchy vegetables. Then it is also important to minimize added sugars and refined grains, and to choose whole foods over highly processed foods to the extent that is possible. So, of course, the reducing overall carbohydrate intake has demonstrated the most beneficial evidence for improving glycemia and metabolic control in people with diabetes. So, all of these following dietary approaches actually are associated with weight loss, but only if they can reduce the dietary energy that people are taking. So there are only two effective types of energy restriction, no matter what is the dietary approach. This is first the lower calorie intake or increased energy consumptions with realized energy deficit. And so this is the main important way how patients can lose their weight, no matter what dietary approach that they will choose to be their preferred way of nutrition. So there is no strict dietary recommendations, but only restriction in energy and choosing healthy food uh, for nutrition, and of course a higher level of physical activity in order to lose some calories during this physical activity. So this is the plate for people with diabetes, or how the nutrition in people with diabetes should be. And of course, this marked food here, it is the only food that is the main regulator of postprandial glucose, and the people with diabetes should be very careful when they are choosing food that contains carbohydrates. There is a couple of tips that is very important for healthcare professionals, and how they can teach their patients what is the main importance in their nutrition. The diabetic diet plan is focused on a healthy diet that can control blood glucose and also prevent diabetic complications. There is no specific diabetic meal plan, and this plan must be developed to meet the special needs, like individual food likes of each patient, their daily schedule, the medication they used. And actually, what is the healthy diet includes, it's a variety of foods from all food groups with no specific percentage, but still low. The food should be low in fat content, moderate in protein content, then high in carbohydrates, but not all of them. More carbohydrates like beans, vegetables, and grains. And of course, the diet should be consistent to deal with diabetics. They should eat approximately the same amount of calories every day, then to eat meal and snacks approximately at the same time, to spread meals and snacks throughout the day, never to skip meals, and of course, always to watch for a portion size. So this is in a picture what is the good and not so good for nutrition of people with diabetes. Of course, always less sugar and salt, more fish, more cereals, but slowly absorbed carbohydrates, regular meals, and of course enough liquids. I would like to represent what are the three main pillars which are the most important for healthy nutrition in people with diabetes. Then first, it's a healthy diet or dietary approach, then portion size, and finally, food label. So what is a healthy diet? Healthy diet, it means at least 5 fruits and vegetable servings per day, and at least 6 grain products servings per day. The low-fat diary, 2 servings per day, 2 to 3 servings weekly oily fish, limited servings of lean meat or poultry, and minimal but right choice of healthy fat. And we are speaking what is the healthy choice of fat. we can clearly see at this picture, which shows what is the relation between type of fats and mortality in people in general. So we can see that those who are consuming the most polyunsaturated fat, the risk for mortality is lower than monounsaturated, than saturated fat. And what is very well known, that trans fats are related to the highest rate of mortality. Why is it like this? Because the trans fatty acids, the trans fats, they are mainly in cakes, in cookies, in pies, etc. It is very well known that they can rise the LDL cholesterol, they can lower HDL cholesterol, and intakes of trans fats is strong prediction for early development of cardiovascular diseases, especially in people with diabetes. What is the good source of fats? Of course, these are essential fatty acids, specifically omega-6. And it is also shown that the higher intake of omega-6 is associated with reduced risk for cardiovascular diseases. And this meta-analysis shows that each 5% increase in energy from polyunsaturated omega-6 in place of saturated fats can reduce the risk for coronary heart disease up to 10%. It is the same with omega-3 fatty acids, and it is shown that there is an inverse association with intake of these fats with heart failure, and also they can lower triglycerides. And the Predimed study shows that they're not beneficial only for cardiovascular disease, but only 2 weekly servings of oily fish can decrease even the risk of sight-threatening diabetes retinopathy. And what is the Predimed study that shows what is the benefit of real diet or Mediterranean diet? It was a multi-center trial that was conducted in Spain. It was enrolled more than 7,000 participants who were at high cardiovascular risk, but with no cardiovascular disease at the moment of enrollment. And they were randomized to 3 groups: the Mediterranean diet supplemented with extra virgin olive oil. The next was with nuts. And the third group was like a control diet. The people was suggested to take a low-fat diet, and it was like a control. So the primary endpoint was major cardiovascular events. And after 4.8 years, the trial was stopped, and it was shown that there was a significant lower incidence of acute myocardial infarction, stroke, or death from cardiovascular causes in both groups with Mediterranean diet in comparison to control. But very soon after publishing of this study, there were identified some protocol deviation of this, including enrollment of household members without randomization, and assignment of to a study group without randomization of some participants at one of 11 study sites, and also apparent inconsistent use of randomization tables at another site. And that's why these patients was excluded from the trial. They were withdrawn from the analysis. And there was a new revised report that was published 2 years ago, also in New England Journal of Medicine. This is interim analysis, and we can show in this here panel A that the results are almost the same, that the incidence of the primary endpoint, so the acute myocardial infarction, stroke, and death from cardiovascular causes, is lower in both groups with Mediterranean diet in comparison to control diet. And also in this panel, we can see that total mortality is lower in group with Mediterranean diet and extra olive oil. So after the correction of these results, we can see that really Mediterranean diet is related to better prognosis regarding cardiovascular disease in patients with diabetes. This is another part of this interim analysis, this hazard ratio for the primary endpoint in each Mediterranean diet group as compared to control, and we can see that all of them are in favor of Mediterranean diet group. So the second pillar of healthy nutrition is the portion control. And we know that the portion size of many different foods have increased significantly over these 2 decades, even and previous. And nowadays there is a larger portion size that are offering in restaurants, in selling machines, in packages, and people are prone actually to different size, different kinds of food, but the portion size is larger than it was before. So here we can see that this is happening not just 2 maybe decades, maybe even before, and there is a huge increase in portion size, especially these 2 decades, and this means that there is a larger or calorie intakes, which leads, of course, to obesity and then to high risk for developing type 2 diabetes in population. In this study, we can see what is the percentage difference in average portion size between 1995 and 2011 by food category. So some food categories like pizza, cake, ice cream, sausages, processed meat, cereal bars, there is a significant increase in portion size, which means higher calorie intake and, of course, obesity and diabetes. So the question that we want to know the answer is: does the portion size really matters? So of course that they do not matter, but only if a person is able to choose an appropriate serving size rather than to eat the whole portion that is served in front of him, or to eat the fewer calories which are dispensed in a couple of meals as snacks through the day. But the question remains: do the people intuitively can assess what is the appropriate serving size, and do they actually eat only appropriate servings, or they are eating the whole food that they are offered with? So the answer is that in a couple of research, it was shown in a couple of articles that people often eat the amount of food that is in front of them, and they have really difficulties. They cannot always assess whether this is appropriate amount of food, and very often that they are eating more than appropriate size for them, and that's why they are gaining a lot of weight. So we also in my country published a couple of years ago these articles. We were trying to find what is the reason for high percentage of obese, overweight people in Macedonia the recent couple of decades ago, and why there's a so huge percent of people with diabetes. And we find out that there was a significant change in calorie intake among Macedonian population these last 2 decades, and these calorie intakes increase about 750 calories per person. And there is this number of 53% of population overweight and 20% obese in 2014, and diabetes incidence near to 11%. Also, this Cochrane analysis review that shows that people consume actually more food or non-alcoholic drinks when they are offered with larger size portion. So the size of this suggests that if we can or we are able to eliminate these larger portions from the diet, then the people can reduce their calorie intake and, of course, to lose weight and to reduce their risk for diabetes. There is also another Holland's study with same estimation that is lined with previous ones, which shows that the portion size is really responsible for this higher calorie intake and, of course, higher percentage and diabetes. And finally, the food labels, like a third pillar for healthy nutrition. We also know that the food labels are very, very useful tool that can help patients with diabetes to assess the nutrition value of different kind of food. So in the same way, they can also get some very useful information in the amount of carbohydrate choices, but also in the amount of calories and other important and cholesterol. And that's why it is very important to recommend to all our patients to be aware that it is very important to read the food eating and what the nutrients they are taking with their meals. As the main 10 tips for diabetes nutrition that we must follow to our patients, that they must choose healthier carbohydrates, to eat less salt and less red and processed meat, to eat more fruit and vegetables, and to choose healthier fats, to cut down on added sugar, always to be smart with snacks, not too many snacks, to drink alcohol in moderation. They shouldn't bother with so-called diabetic food, but just healthy food, and of course to take enough minerals and vitamins from food. So if I can conclude, now there is no specific diet for diabetes. There is a dietary approach that we can suggest to our patients, and the main advice is that they must replace saturated fat with unsaturated fat to reduce the heart disease and mortality risk, then to limit red and processed meat and to replace them with healthy protein sources, then to eat a lot of fruits, vegetables, legumes, nuts, whole grains, to reduce consumptions of refined grains and sugar, because a healthy diet and lifestyle which is healthy can add more years to life, and of course more life to their years. Thank you for listening.